Hi everyone, my name is Tineke and I'm one of the co-founders of Five Times More. Today I'm here with the lovely, amazing Dr. Orin. Would you like to introduce yourself, please?
Yes, hi. I'm really glad to be here. I'm Ori. I'm a counselling psychologist that specializes in perinatal mental health. So yeah, thank you for having me.
Perfect. Thank you so much. So today we'll be talking about a topic that is very, very close to my heart, which is postpartum depression. I'm just going to go straight in with the first question. What is postpartum depression?
Okay, so postpartum depression is depression that's experienced once you've had a baby. So that's obviously during the postnatal period, and that would be described as persistently feeling low. So we can all feel low from time to time, but depression is something that will be going on for maybe several weeks, and then if it doesn't sort of lift or abate, then it might be that you do have depression. So that's in a nutshell. But I can talk a bit more about the sort of signs and symptoms
Yes, please.
as
That
well.
that's actually my next
Yeah.
question. What are the signs and symptoms, and what's kind of are there typical and atypical
Mhm.
signs of postpartum depression as well?
Yeah. So typical signs of depression would be feeling low, feeling lethargic, feeling fatigued, having a lack of motivation, not really having much energy, like a loss of pleasure in things that you used to do before, just nothing really kind of moves you much anymore. You can also have feelings of like hopelessness and worthlessness and despair. It can also be tied in with other feelings, sort of shame and guilt as well. And there can be also irritability as well, just feeling sort of like a low level or a high level irritability all of the time as well. Everything just feels difficult. Thinking about the future just feels very bleak as well. So it's like I guess it could be described as a loss of hope for the future and a loss of, I guess, vibrancy in your life. Other signs are also that you might just avoid doing things, engaging with other people, going out, like engaging with your life, going out and about. Like there's an avoidance. There tends to be sort of like a withdrawal and a retreat for some people. So that's what I would say them. And also it could also be accompanied with suicidal ideation as well. So, feelings of not wanting to be here, which can be passive or they can be a bit more active than that. So that's obviously something to be really mindful of. And I would say a typical symptoms of depression, I guess I would describe it in terms of people who are high functioning but they're depressed. So they can maybe get out of bed and they can do what they need to do and they can take their kids to school and they can do the things around do the chores around the house and all of those things, but the feelings are very, very prominent for them. But I suppose behaviorally they're able to kind of override that lack of motivation, whereas some people can't. They will not be able to get out of bed. They will be in bed all day, or it would, it really take them a lot of effort to get out of bed. And there's also, I forgot to mention, there's also like self-neglect, not looking after yourself, not attending to your hygiene as well. But I think sometimes people can think somebody isn't depressed because, oh, they can do all of the normal functional things that we do. But actually, the
Mm.
feelings of worthlessness, the feelings of hopelessness, the despair, the bleak outlook for the future is very much present. So I suppose it's more internal, and obviously people can't see that if you don't say, or if they don't know you very well. So that's what I would say is an atypical
You know what?
presentation.
I'd love to touch on that.
Mhm.
Those atypical signs, because I feel like, especially within our community, the atypical might be a little bit more common. And I'll
Mm,
tell you why. Because we're just expected to get on with it. We get on with it. We don't complain. We just, your mum had a baby, your sisters had babies, your aunties had babies, your friends have had babies. You grow up hearing things like, you're not the first, you're not the only one.
mm,
The other people who have done it do not have two heads. And so then you
mhm,
start to feel like, oh, actually, maybe I am just over exaggerating a little bit,
mm,
and you keep going, right? You keep doing
mm,
everything like normal, but inside, mentally, internally, you're crumbling. And
mm.
I think that might be, that's why I wanted to touch on those atypical signs, because sometimes it might not present the same way in different cultures and across different ethnicities.
Yeah,
Are you
yeah,
able
yeah.
to touch on that?
Yeah, definitely. I definitely agree with that. Sort of like having to just get on with things because I guess, yeah. In I mean, I'm Nigerian. In and I know you are as well. And in our culture, yeah, there is a sort of like, you just get on with it. There's nothing special or different about what you're going through to other people. So then there's more of a pressure to have to do as well. Whereas I think in Western cultures, there is a bit more of an acceptance as to like, oh, if you're depressed, this might be how it presents. I mean, all of these signs and symptoms that I've just talked about, I mean, you can find that quite easily on sort of like the NHS website. Like the healthcare system in this country understand that this is how it presents. So I think when they're then looking at people from you know, other cultures, ethnic minorities, they may not really be able to recognize that actually they are depressed because it doesn't look this this particular way. And I think another thing to say is also, I think it can also present more as like a flatness. So like they may not necessarily be, you know, crying or sobbing or like expressing their emotions in that type of way, which can be, you know, being tearful can be a sign of depression, very tearful sign of depression. But I think it often, just, I'm just speaking based on sort of like people I've worked with, that it presents often as like a flatness, sort of like being quite detached,
Right.
so like a little bit disconnected, dissociated, which I think people can then misperceive as anger
Yep.
or
Arrogance
arrogance,
yep,
you know, those
yep,
kinds of things. But actually, that type of flatness is a sign of depression. And they
yeah,
just, especially if they're having to function and they haven't spent all of their resources doing that, what other resources do they have left to be
right,
expressive or to,
right.
you know, present in all of these different ways, especially if staying in bed all day is not culturally acceptable as a mum, and they don't have that option to be able to do that.
Yeah.
What do they do? It has to go somewhere. So yeah, I think it's a really important point and an important distinction as well for black, you know, for black mums as well, to also think about that when maybe they feel like that's how they're presenting, and maybe they can't really make sense of that.
That, yeah. And how that could put that, how that potentially could look like for us. I think
Mm.
it's so important because sometimes, like you said, like it's that flatness and you can't really describe it and you can't put your finger to it, but you're like, I should be grateful, I should be happy, I've got this
Mm.
baby, you know, I might have had a good experience, a bad experience, giving
Mm.
birth to said child, but you know, the baby's here now,
Mm.
everyone's fine now, like I said, get on with it. But
Mm.
actually that those feelings might be persistent, and actually getting help might be the
Mm.
next best thing. But then next thing to do, sorry. So because of, you know, past trauma, past experiences,
Mm.
and things we've heard from other people or may have experienced ourselves, I feel like sometimes it might be a little bit difficult to want to try and seek that help.
Yeah.
How do you go about trying to get help and support if
Yeah.
you've got postpartum depression?
Yeah, it's really, really difficult because again, like the motivation isn't even there. You might know
Yeah.
you need help and want
Yeah.
help, but the effort it requires to actually do that, and then also not knowing what type of response you can get, especially with there's a lot of stigma around mental health anyway, but mental health within you know, ethnic minority groups as well. So I think it's really, really difficult. I think some ways are, you could kind of like, I suppose, identify the people you class as safe people in your life, and then that might be the first step as to kind of talking to them. And
Okay.
hopefully these are people that are kind of would encourage you to get help and wouldn't sort of feed into the narrative of, oh, I mean, you know, well, it's all it can be like this, but that you don't need to, you know, you don't need to go to the doctor about it. So people who are
Yeah.
actually safe, because that's not a safe response if somebody says that, even though they might not mean to be unsafe, but that is
Oh,
an unsafe
yeah.
response. So
Hmm.
I think identifying safe people you can kind of talk to, who maybe can kind of encourage you or support you with going to speak to your GP or your midwife or whoever it might be. I think also, I mean, I know there's a lot more like community groups for ethnic minority mums now. So I guess maybe connecting through like the work that you do, like 5 times more do, and there's other organizations that are really kind of championing that the experience of Black mothers as well. So I think connecting through that, and sort of like, you know, that hopefully will help to normalize that, yeah, other people do experience this
Hmm.
as well. And I think also just gaining knowledge about mental health as well, and so that it doesn't feel like something that's that alien. And you can do research yourself if you have the energy to do that, but just so you know that there is actually help out there, that because I think sometimes people will feel, but who's going to help me, like how am I going to get help, and all those kinds of thoughts can even stop you from. But I think if you actually know what types of services and things are out there, then that might at least give you a bit more, you know, motivation to think, okay, I could go down that road, or I could speak to my GP as well. But it's difficult because you can do all of those things, but I think at the end of the day, it's like, are you able to have the courage to take that step and actually say, yeah, I'm not okay? And that's an internal thing.
Right. Because I was going to say that literally was my next question. Like, how do you even find the strength to say that you're struggling?
Yeah. How do you find the strength to say that you're struggling? It's difficult. I think it starts with being honest with yourself first before you then go and say to somebody else, I'm struggling. Because I think you can't really tell anybody you're struggling if it's difficult for you to admit that to yourself. So I think the first step is, and it, you know, it can be like a slow, gentle process, is to really start to check in with yourself and, you know, check in with how you're feeling, whether things are not okay, and noticing yourself and paying more attention to yourself. And then, and the more attention you pay, and if things are not okay, it will become very apparent to you that things are not okay, and actually you can't necessarily ignore it. And then I think it's that self-trust, isn't it, that actually what I'm feeling is valid. And so hopefully that can then propel you to say, actually, no, I do need help. Like I've been thinking about this, I've considered this, I've been sort of checking in with myself, and I know I'm not okay. I need some support. But it's difficult. I think support around you can really help with that. And they, you know, sort of people that can advocate for you and kind of notice and say, yeah, you don't seem okay. Like people who know you well, and listen to people who are safe and know you well. I think it's important to kind of pay attention to what the observations they might have about what might be going on with you, because sometimes people can see things that you're not aware of, or you don't want to be aware of for whatever reason. So just really using those resources if you have them.
I think it's why it's so important to raise awareness of these kind of issues. So people who are supporting you, the safe people.
Safety. There are many unsafe people out there. So.
Plenty, my sister, plenty. But the safe people who are supposed to be supporting you and keeping an eye out for you and stuff like that, so they understand what the signs are and what they can do to kind of help, and maybe start asking those initial questions. You know, I've noticed that maybe things are a little bit different. Are you okay? And you know, encouraging people to speak.
Exactly.
So yeah, it's important to identify your people, and also, like you said, just be honest with yourself. What are the forms of support? So let's say you've identified you potentially have postpartum depression. You've spoken to someone. Let's say in an ideal world, you've spoken to someone and a friend or a family member, and they've said, you know, I think maybe you should go and seek help. What exactly does help look like? Is it talking therapy? Is it journaling? Is it like what kind of thing can it be to try and help you know, with postpartum depression?
Yeah, so I mean, with that, I guess if you're going to go down the route of the NHS, then the first person would be to talk to your GP. It depends on sort of like where you are in the postpartum period. If you're very sort of early on in the first kind of month or something, then you'd still be under midwifery care. So you could speak to your midwife, and they can make a referral to talking therapies. So different professionals can make that same referral. It just depends on who you have the most contact with. So it might be your GP if you're no longer under midwifery care, or it might be your health visitor actually. After that first month. So just because, and they're also, you know, trained and to be able to kind of pick up if something is not quite okay. So they should be quite on the ball with that, really. But those are people that you can speak to. And then in terms of the levels of support you can get, so you can either be referred to talking therapies, which is a primary care service. So that's kind of like the first level of care that you can get from the NHS for your mental health. And so that might be more for people who are experiencing more mild to moderate and postpartum depression. So it's significant, and it's obviously impacting upon their life, but they have some functionality with that. Whereas if it's more severe than that, you might be referred to a perinatal mental health team, basically, and they work with people who are experiencing more moderate to severe levels of depression
Okay.
as well. And so those professionals can make that referral. You can't self-refer to the perinatal team, but you can self-refer to the talking therapies team yourself as
Okay.
well. So you don't have to wait for your GP to do that. You can do that yourself. And then the third level is a mother and baby unit. And so that's for people who are really, really, really not well and really, really struggling. And they need that in sort of like in-house support. So that's the case of, it is an inpatient unit, but they tend to make it quite, you know, a bit more homely and stuff. Obviously they have mums and their babies there, and they have different professionals who can support you on your recovery. So that's, I guess you can get therapy by talking therapies of the perinatal mental health team. They also offer therapy on a mother and baby units, but there's also medication as well. And you can get medication at the GP level or the perinatal mental health. They have psychiatrists in that team, and also in the mother and baby units, they also have psychiatrists who deal more with the medication side of things. And then lastly, there's peer support as well. So perinatal mental health teams can also offer peer support as well. And there's a lot of research to show that peer support really helps mums recover from, you know, postpartum depression or any other mental health difficulty they might be having.
Okay.
Yeah.
Peer support. Now, I obviously like working in this space, like I'm privy to what that means. But at first, when I came in, I was like, peer to peer. What is that? Like, what does that look like? What does that mean? Could you explain more for maybe the people who might not understand what that means?
Yeah. So peer support is, so I'll talk about it in the context of the perinatal mental health team. So those are people with lived experience of perinatal mental health difficulties, whether that's depression or anxiety or any sort of mental health difficulty at that time. So I work in a perinatal team, and we have peer support workers there, and they can offer sort of one-to-one support. So they can kind of come to your home, they can kind of accompany you as you sort of like try to get out and about, or you can meet up with them for a chat, and they offer their expertise from their lived experience as to like maybe how they've coped with things or how things were for them. So it's very much around normalizing the experience and like knowing that you're not alone, and actually being able to see that people do recover as well, because obviously they're peer support workers. I mean, it's relative, isn't it? I mean, people can struggle with things at any point in their life, but I suppose they've I guess achieved a certain level of recovery in order to feel that they have enough space and resource to be able to support someone else. So they can really kind of, that's something that you're not going to get from a psychologist or a nurse or a psychiatrist. It's a very different thing. So that's what it is. They also do run groups as well, so you can kind of meet and connect with other people.
Perfect. Thank you so much for explaining that. And I guess maybe the last question, or I guess, yeah, if someone, what would you say to someone who is currently experiencing that or thinks that they're experiencing that? What's one piece of advice you would give that's maybe quite practical that they can do?
So one piece of advice I would say is, I guess it's said a lot, but I would say just try and speak to someone safe, and just start, because it's the first thing of being able to open your mouth and say, I'm not okay, I'm struggling. Because I think when there's lots of there's the silence around it, you can't speak, you can't vocalize what's going on with you. It's really, really difficult. So I would say it's just seek help where you can, find out where the help might be, and seek help where you can, and then that's the beginning of the journey. And there are people that really are passionate about this and want to help and want to support. There really, really are. So yeah, that's what I would say.
Yeah, it's just getting to that first step. It's a very brave step.
It is a very brave step. Yeah, it requires a lot of courage. It does.
Yeah, it takes a lot. It takes a lot of courage. Okay, perfect. Thank you so much. To everyone who is watching, I will make sure I link any resources down below. But yeah, thank you. This was a really interesting chat, and I'm sure I'll see you again.
Yeah, thank you for having me.
Thank you.